Okay, assalamu alaikum. This is another case. We're going to do a night guard. This is indicated for the patient. Now, the night guard, we're going to talk about the TMD scanning, how to chart all of the muscles, included inclusion, and in terms of pain scores, and we're going to do a separate video on that next time. But the idea here is I asked you to have a posterior separation between the teeth, 3 millimeter. I told you it should be 2, but we are leaving leeway for finishing and polishing and so on.
Yeah.
Now, where are you going to measure the wax thickness posteriorly?
We should measure the wax between the cusp tips of the opposing teeth.
Don't measure the wax in here because these
here.
are thick. These are already thick, but they are not included in the interocclusal space. So when we measure, we have to measure from cusp tip to cusp tip. Secondly, what did I ask you? I asked you to cool down the wax. Yes? Why did I need you to cool down the wax? Because I wanted this not to penetrate in it. If it was warm from
was
inside the
soft,
mouth, it will penetrate. So I'll not measure it. So measure it, please. From in between cusps, upper cusps and lower cusp. No, posterior, the most posterior.
The most posterior?
Yes, this is the occlusion where we are looking for. The most posterior cusp to cusp contact, how much is this? 2 millimeter. Now, 2 millimeter, even less than 2 millimeter. Is this sufficient? No. I would ask you to increase it to 3. Why? Because if this was interocclusal space less than 2, and there is a polishing and polishing process for
will be less and less.
so it will be less and less. So what is the risk if it was 10? What is the risk?
And the acrylic might fracture.
Might fracture,
From the
yes,
high
or
occlusal
perforation.
load of the
Yes,
patient.
yes.
Yes.
So this was a video just concentrating on how to measure, where to measure, and what material. Do you have any alternate material than this, other than using wax to do it?
Maybe Oculofast, silicone.
Okay, maybe Oculofast. But if in terms of you're going to use an Oculofast, I will ask to you. I don't want the patient to overbite. I could suggest. I don't know if it's practice or not, but I would suggest put a temporary composite stopper measuring 2 millimeter, bond it, okay, just lightly bond it, or like spot etching. Bond it, put a stopper posteriorly, it will act posteriorly as a stopper. So no matter what material you're using, you're always taking the 2 millimeter you want.
Accurate.
For why not?
Yeah.
So pinpoint acid etching, build a ramp of composite on the posterior tooth of the lower, for example, and make sure it's 2 millimeters away from the posterior, and then take the bite in RCP with any material in between. There you will be sure that the separation posterior is 3 millimeter. So that is another way. Just a suggestion, an invention if you would like. I have never read about it, but if you have any comments or you have read about it, please let me know. Okay, thank you.